So, what builds to this cardiovascular disease, and what are the physical or bodily disorders that happen?
You see, if we see at these heart diseases, the blockages in the coronary arteries, they are because of deposition of cholesterol inside the blood vessels. And this deposition of cholesterol in the blood vessels causes narrowing of the lumen of the blood vessel, with the result that the blood flow in that vessel cannot flow properly. That means it's obstruction to the blood flow. So, why this cholesterol deposit builds up? There are many causes, but there are certain risk factors which we know commonly, which increase the chance of deposition of these cholesterol. This we know as risk factors for development of coronary artery disease or atherosclerosis. The process of deposition of cholesterol in any blood vessels is called atherosclerosis. When they deposits in the coronary artery, we call it coronary artery disease. If it deposits in the blood vessels of the brain, we call it carotid artery disease. If they get deposited in the blood vessels of the other vessels, we call it peripheral artery disease. So wherever they get deposited, they cause obstruction of flow in that part of the body. But today we are talking about the coronary artery disease, where the deposition of cholesterol inside the blood vessel. The risk factors that we are talking are of two types basically, the modifiable risk factors and the non-modifiable risk factors. When we say non-modifiable risk factors, these are the risk factors which we can't modify. For example, our heredity, increasing age, the chances of this disease become more as the age advances, and the male sex. Male sex is more prone to get this disease in the adult life. However, female after the menopause, they also have almost the same risk as the male population to develop this disease. They are protected only till the age of menopause. So these are the non-modifiable risk factors. There are other important modifiable risk factors which are usually related to our lifestyle, how we live and how we eat, how we exercise. And these risk factors are cholesterol in the blood, the lipid levels. The higher are the cholesterol levels, particularly the harmful cholesterol, which we call as LDL cholesterol, the greater will be chances of developing this disease. Then the diseases like high blood pressure, diabetes, smoking, obesity, sedentary lifestyle. So these are the risk factors which basically increase the chances of getting these diseases.